President. I think there are a couple of, let me just mention just a couple of specific things that are part of the law. One is there is a provision called the Class Act, which is going to allow workers in the current workforce to begin to voluntarily decide to have a payroll checkoff and put aside some money that they can draw on later to provide the kind of residential care that I think is being talked about. So if somebody needs to come to the house and help with lunch or bath or go to the grocery store, those kinds of features, so you'd have your own savings account to be able to draw on that, and that will be managed as part of the law. And I think allow a lot of people to have more choices. Just yesterday or the day before, under the Department of Aging, we released grants to the communities, which are going to help governors like Governor O'Malley and his senior volunteer program get the word out to families about what their options are. For a lot of people, particularly if something happens quickly, somebody suddenly gets much sicker than they were, needs help, a lot of families don't know what their options are, don't know if there's anything other than a nursing home available. And so part of choice is knowing what is here in Maryland, what's around the country, what are those options. So these will be counselors who will be able to meet with families, meet with family members, and talk about where the options are. There are also a whole series of medical strategies in the bill that provide for wraparound care once a patient leaves a hospital. So a home health team where somebody may need some follow-up. They don't really need to be in a full-time residential care, but need somebody to follow up. You know, did you fill your medicines? Are you having any problems? Are you experiencing any trouble? So the bill also has a whole lot of features that I think will make the kind of choices much easier for people. And finally, the Caregiver Act. There is a program now which is part of the overall President and Vice President's move forward, which will provide for benefits for family members who are helping to provide for care services. Because sometimes in tough budget time, it's tough. People are running out of money, and they think, you know, I want to help my loved ones stay at home. I want to provide the care, but I'm trying to raise kids and take care of an aging parent, aunt and uncle. I don't have the resources, or I need a day off, or I need some help going to the grocery store. So there's going to be some caregiver money. Knowing that about 80% of long-term care services are really provided in communities by loved ones right now, and they just need a little help. So the system is going to get stronger to give those choices across the board, and I think all that is good news for Americans.
Good.
Yes, sir. And again, if you would say your name, that would be great.
I'm Ben Williamowski. I'm a senior citizen who lives in Maryland, Silver Spring, Maryland, and I want to thank...
nice to see you again, Doctor.
Nice
it's lovely to
and I want to thank Secretary Sebelius and the President for allowing me the opportunity to be here and ask this question. I'm asking it more on behalf of my children who are in their late 50s and 60s, and my grandchildren and my great-grandchildren. But I have heard from some of my friends who are who spread the myths, who are against the health care bill no matter what it says. Of course, they were me about the death panel, of course, which is dead. But one of the things that they bring up, and I heard this same argument in 1965, with providing Medicare, at this point, we not be concerned with this at our ages. Our children may be, that we will soon, with the program the way it is, that Medicare and Social Security will soon run out of money. Now, as I say, that concern is not so much for me at my age, but for my children and their children.
Well, it is a wonderful question. So let me talk just about the finances of health care bill, Medicare, and I'll throw in Social Security in there. We have a genuine term problem, and I can describe it very simply. We've got a population that's getting older, so you're going to see a bulge in the number of people who are using Medicare and Medicaid, more recipients, fewer workers to support those programs. got more money going out, less money coming in. And that's going to worsen over time. Now, it has nothing to do with the health care bill. That has to do with the fact that we've got an aging population and health care inflation. Cost of the additional costs of health care each year is going up much faster than inflation and how fast wages and taxes, et cetera, are growing, right? So we've got this gap between how much we're going to need for Medicare and Social Security versus how much is actually coming into the programs. That has to be fixed. Now, one way to fix it would be to just say, we're just going to cut benefits. If there's going to be a gap between how much Medicare is going to cost and how much we have, we just say, you know what, each of you, we're going to have to eliminate some benefits. You get fewer prescription drugs, you pay higher co-pays, you got to, certain procedures won't be covered. Maybe some people won't be covered. We'll raise the eligibility when you qualify for Medicare. I mean, there are a bunch of adjustments that could be made that essentially come down to cutting benefits. That's one way of dealing with rising costs of Medicare. Another way, which we think is the smarter way, say, where are we getting good value for our money? Are we not getting good value for our money? How can we design Medicare so that we're reducing the costs that are skyrocketing, but people are actually getting better care? There are ways that we can do that. For example, can we have one test instead of 5 tests, have one test emailed to everybody so that Medicare is not paying for 5 tests? We arrange so that because we've got a good primary care physician, you make one visit to the doctor's office and all the specialists come to that one office, as opposed to you having to make 5 different visits. Are there ways in which we can use best practices for certain diseases so that we're catching them sooner, cheaper to care for than when we're really gotten sick? What we tried to do in this health care bill is actually see how can we make the health care system as a whole smarter, more efficient for everybody, including young people, not just for seniors, because obviously health starts, the healthier you are when you're younger, odds are the healthier you're going to be as you get older. Are there ways that we can, through prevent care, better efficiencies, better management, make the healthcare system overall more effective? If we can do that, then that starts controlling the cost of Medicare and won't go bankrupt as quick. A lot of those changes are what we introduced in our health care bill. Now, in addition, the health care bill overall, because of us eliminating those subsidies to insurance companies that I mentioned, are going to save $1 trillion out of our deficit for the long term. $1 trillion, that's with a T. A lot of money. So when you hear arguments out there that, well, we couldn't afford this health care bill, you're saying that they didn't read the bill. Because according to the Congressional Budget Office, this will actually reduce the deficit costs by making the system smarter, making it more efficient. That in turn means that Medicare will be there longer. Now, the one thing I want to say about both Medicare and Medicaid, though, the health care bill alone will solve all our problems. And I don't want to over-advertise. The truth of the matter is it's very hard to change a health care system that involves millions of patients, tens of thousands of doctors, hospitals, all those systems all across the country. Trying to manage that all from the top is just too hard. What we try to do is new incentives, find who's doing the best job treating what, advertise those best practices so that other people start adapting them, and over time that trickles throughout the system so that the system overall gets more efficient. That's what we're trying to do, and it's going to take some time. It's not going to happen overnight. It's going to happen over the course of a decade, maybe 2 decades in some cases, before we're actually